Hello, friends. Good morning, and it's beautiful to have you here. Today, we want to discuss very quickly microbial diseases of the urogenital system. Microbial diseases of the urogenital system. Now, it's important to note that whenever we talk about microbial diseases, we understand that quite a number of organisms can cause these diseases. You can have bacteria, you can have viruses, you can have fungi, you can have parasites, you can even have worms, the helminths, causing all these diseases of the urogenital system. So we can have different agents, different infectious agents causing these diseases. So the next question we'll ask is, what do we mean when we talk about the urogenital system? Now, when we talk about the urogenital system, we're talking about the system for the production of urine, all the way from the bladder to the ureters, sorry, from the kidney to the ureters, from the ureters to the bladder. The bladder is sort of a storage organ, from the bladder to the urethra, from the urethra out of the body. So any infection that occurs across or along this length of the human body, whether it's at the kidneys or at the ureters or at the bladder or at the urethra, is what we call the diseases of the urogenital system. Now, it's important to note, like I said earlier, that many different agents are capable of causing diseases along this system. And for today, we just want to look at the some of the bacteria that are able to cause diseases along this length of the human body. Now, it's important to note that many of these diseases are referred to as urinary tract infections, UTI. Back in the days when we were not this knowledgeable in science, we used to call them toilet diseases. But today we don't use that term anymore. We refer to them as urinary tract infections. So it's important to notice, to discuss some of these urinary tract infections. And there are many of them, but we'll look at the ones of bacterial origin. First, it's important to know that many organisms have been implicated when it comes to urinary tract infection. You have Escherichia coli, a lot of Escherichia coli. You have chlamydia species. You have Proteus mirabilis. You have Staphylococcus, some species of Staphylococcus, and you even have your Enterococcus fecalis, which is really well known as a pathogen that causes infections in the urinary tract. And Enterococcus fecalis is particularly important because it affects a lot of women, and it is because of the proximity, the closeness that exists between the anus or the anal orifice and the opening of the vagina or the vulva, where you have the urethral opening for women. Because of the closeness of these two areas of the body, when hygiene is poor, woman has the can make the mistake of introducing fecal materials from the anus into the vulva, the vagina, and the urethra. So these can be a source or a site for this kind of infection. This is important to note and to understand. So all these different kinds of bacteria have been implicated, and they cause different types of urinary tract infection. When women suffer from urinary tract infection, some of the signs and symptoms that can be seen is painful urination, which we call dysuria. That's when the woman or a man has a lot of discomfort in passing out urine. So this happens. And when this happens, that can be a sign or a symptom of urinary tract infection. You have fever, you have pain. Then sometimes for women, they have pelvic inflammation. They feel pain in their pelvic area, pelvic inflammation. So all these are signs that an individual may be suffering from a urinary tract infection. Sometimes you also have frequent urination, you have pain when urinating, you have discomfort. Then sometimes the urine, the color can be it can be frothy, it may not be clear. Then the smell of the urine might be really, really bad. It could have a fishy odor, it could have whatever odor it is, which indicates, or it's an indication that that individual is not healthy. This is very important to know. Now, also, it's important to know that many of these illnesses, these diseases of the urinary tract, we name them according to the site or the organ or the area that is infected. This is important for us to know. When we say urethritis is just from urethra. So you know that that infection is in the urethra. That's urethritis. When you have cystitis we know is an infection that occurs in the bladder. So when you have infection in the bladder, you call it cystitis. Then we also have pyelonephritis. Pyelonephritis, is from the nephron. You know, the nephron is the functional unit of the kidney. So when you say pyelonephritis, you're talking about infection in the kidney, which would affect production of urine and affect every other thing. This is just where we are stopping today. Tomorrow we'll look at sexually transmitted infections in which affect the urogenital system. Remember to make it a date with us tomorrow. Check any of our videos when you leave. Remember to like, subscribe, and share our content. It's always beautiful when we discuss our science and we're going nowhere. Have a beautiful day.